it's Courtney at Radiant Skin Therapy. I wanted to do a little educational video on the different tools that we use as injectors when we're doing fillers. So some of you may know, because you've had fillers before, that we use a needle or a cannula, and some of you may have only seen it on Instagram or YouTube, but I thought it might be beneficial to kind of go through those differences and kind of explain why we choose to use one versus the other, or sometimes we choose to use both. So I think the most important thing is to say that our priority as injectors is your safety and your comfort. So there may be reasons why we choose one over the other based on where we're filling in the face. It might also be because of your anatomy and your goals that you want with the filler. So let's start with the needle. So a needle obviously is a sharp object, and when we use it in the skin, it punctures and it makes placing the filler pretty easy, because we just puncture right in and ensure that we're in the correct plane and then start to lay down the product. So a needle, we usually use a couple different sizes, either a 27 gauge or a 30 gauge needle, depending on the look that we're going for, or kind of our technique. So needles are pretty precise, they are sharp, and it gets us right down into the plane that we need to be. So depending on where we're at on the face, we might want to go deep, actually kind of right down onto bone, because that's the safest place to be when injecting filler in a certain area. There are other areas of the face and other times when we don't need to be as deep and we can be a little bit more superficial, so we might choose to use a cannula. So a cannula is actually a blunt tip device, and it actually is kind of flexible. So you can see here it's not sharp, and it's like a hollow tube. So in order to get a blunt tip object into our tissue, we do need an injection site. So we will use a needle to create that injection site, and then we will go in with the cannula and kind of start laying in the filler. So the benefits of using a cannula is we don't have to poke you as much, so that reduces the trauma, and then it also kind of reduces your chance of swelling and potentially bruising, since we're not doing multiple injections. I will note that it is still very important to make sure that you're choosing a very experienced, knowledgeable injector, because any tool in any random person's hands can cause issues. So it doesn't really matter the size cannula, whether you're using 27 gauge, 25 gauge, you still want to make sure you're seeing an experienced injector who knows how to use these tools, who has been trained and knows the different techniques with these different objects. So that being said, I thought it might be kind of fun to do a little visual for you. So this way you can actually see that a cannula is not sharp, and obviously the needle is. So you can see with the cannula, it's bouncy. It doesn't puncture this balloon, and that's why it kind of reduces our risk for trauma, or there's less trauma involved. Some people say that it is a weird feeling when it's kind of going through the tissue. You might feel little twinges if it kind of gets on a nerve, or some people have described it as a worm feeling. I don't know about that, but it can feel a little weird compared to a needle, but it doesn't feel obviously sharp like a needle. Then we have the needle, so you can see punctures. So this isn't to scare you, but it's just to let you know that we do have different tools in our toolbox as injectors. We have our cannulas, our needles. Sometimes we choose to use the needle over a cannula and vice versa, and other times we get the best results using both. So if you have any questions, feel free to comment, Or if you're interested in learning more about fillers, we would love to have you call Radiant Skin Therapy to book a complimentary consultation where you can meet with one of our clinicians and kind of go through fillers and everything that it involves. So thanks for watching. I hope you enjoyed. Take care.